was a typical teenager. Back in the day, we didn't usually put on sunscreen as much. I tanned outside. I went to tanning beds before dances, before vacations, thinking that if I got a base tan, then I wouldn't burn as much. Honestly, I didn't burn that much. I was more tan, so I didn't really think about skin cancer. My dad's Cherokee, and so obviously I'm partly Cherokee, so I didn't think it was something that I needed to be concerned about. And so fast forward about 20 plus years or so, and I started noticing, kind of like what you do as women, we do our breast checks, and I started noticing I had more moles all over my body. And I had one pop up that I had never had before. It was dark in color, and the edges were jagged. And so I went into a clinic and asked them to look at it. They said it was fine. Everything was good. Don't worry about it. I just had a gut feeling that it wasn't good. So fast forward about a year later, and I ended up going to KMC, and they did a biopsy on it. And Dr. Gadzia, actually, he was the one that called me a few days later and said, it's melanoma. You need to get in here now, and we need to do surgery. And so I ended up having surgery to remove the melanoma. Luckily, it was an early stage.
Now, you had mentioned before when you and I had talked that it was a pretty unique location for the mole. Can you tell us a little bit more about that?
Yeah, so it was. It was on my rear, actually. I do not tan, just showing my rear to anything. So it was very different for me. I never had anything like that. And like I said, usually when you're in the shower and you do your breast exams, you also kind of check all over. And that's when I noticed it. And I thought it was very strange. So yeah, it can be anywhere. And that's something that a lot of people that I talk to, it's not necessarily, just on your arms or your legs or your face. It can be anywhere. And so, yes, it was on my rear, and it was very different. Yes.
Okay. So now that you've had melanoma, how are you approaching things differently?
I am a totally different person. I used to go to Florida on vacations every summer, and I would be the one out there tanning morning to night. Baby oil and iodine was the thing back then, and I am a completely different person. I do have 2 teenage daughters, and I have always put sunscreen on them because they were lighter skinned. That's why I was doing it. But now it's put a different perspective in my life of it's not just about the color of your skin. It's you're trying to protect your entire body. And so I sunscreen all the time now. Even if I'm going outside to cut the grass, I put on sunscreen. If I'm putting on makeup to just go outside now, I put on something that will help me. I'm somebody who does like to be tan. And what I end up doing instead now of going to tanning beds, which like I said, I didn't do it often, or tanning outside, I use a lot of self-tanners. And that makes me feel good for some reason, but it's a better alternative than to actually tan in a tanning bed or not use sunscreen.